Have you ever heard of immune thrombocytopenia? Maybe not, and that's okay. It's a condition that doesn't get a lot of attention, but it's one that can turn someone's life upside down. ITP, as it's often called, happens when the body starts attacking its own platelets. Platelets are the tiny cells in your blood that help it clot and stop bleeding. Without enough of them, even a small bruise or cut can become a big deal. Imagine living your life like that, always worrying about getting hurt or bleeding too much. It's not easy, but understanding it can make a real difference. Stick with us to learn more, and don't forget to subscribe to Earthluxe for more important stories like this. What is immune thrombocytopenia? Alright, let's keep this simple. Immune thrombocytopenia is a condition where your immune system, which is supposed to protect you, makes a big mistake. Instead of fighting off harmful things like viruses, it attacks your platelets. Platelets are the cells in your blood that stop bleeding. They clump together to form clots when you get a cut or injury. When your body destroys platelets, it leaves you with fewer of them to do their job. This makes it harder for your blood to clot. People with ITP can get bruises easily, have frequent nosebleeds, or even notice that they bleed for a long time after a small injury. What's really tricky about ITP is that doctors don't always know why it happens. Sometimes it shows up after a viral infection. Other times it can be triggered by certain medications. And in many cases, it seems to appear out of nowhere. That unpredictability makes it even harder to manage. What does life look like with ITP? Living with ITP is not easy. People with ITP have to think about things most of us never even consider. Imagine worrying that bumping into a table or brushing your teeth might lead to bleeding. That's what life is like for someone with ITP. And it's not just the physical symptoms. Fatigue is a big problem too. People with ITP often feel tired all the time. It's not the kind of tiredness that goes away after a good night's sleep. It's a deep exhaustion that makes even simple tasks feel like climbing a mountain. For kids, living with ITP can be even harder. They just want to run, play, and be kids. But parents often have to stop them from doing risky activities. Imagine telling a child they can't play soccer with their friends because it's too dangerous. It's heartbreaking for parents, and it's tough for kids to understand why they have to miss out. Adults with ITP face different challenges. A lot of people don't understand what it's like to live with this condition because it's not always visible. If someone doesn't see the bruises or bleeding, they might assume everything is fine. But inside, the person might be dealing with constant worry and stress. How is ITP diagnosed? If someone notices unusual bruising, frequent nosebleeds, or bleeding gums, they might go to the doctor. The first step is usually a blood test. This test checks the number of platelets in the blood. If the platelet count is low, it's a sign that something might be wrong. But diagnosing ITP isn't that simple. A low platelet count doesn't automatically mean it's ITP. Doctors need to rule out other conditions that can cause low platelets, like certain infections or bone marrow disorders. Once other possibilities are ruled out and the symptoms match, doctors can confirm that it's ITP. How is ITP treated? The treatment for ITP depends on how severe the symptoms are. For some people, the condition is mild enough that they don't need any treatment at all. Doctors might just monitor their platelet levels to make sure things don't get worse. But if the symptoms are more serious, treatment is necessary. The first option is usually steroids. Steroids work by calming down the immune system so it stops attacking the platelets. For many people, this is effective, but steroids can have side effects, especially if they're used for a long time. If steroids don't work or aren't enough, there are other options. Some medications help the body produce more platelets. Others target specific parts of the immune system to stop it from attacking the platelets. And in some cases, doctors might recommend removing the spleen. The spleen is an organ where platelets are often destroyed, so removing it can help keep more platelets in the blood. The good news is that new treatments are being developed all the time. These treatments give patients more options and better ways to manage their condition. The emotional side of ITP living with ITP isn't just physically challenging, it's emotionally exhausting too. Imagine waking up every day and wondering if something as simple as bumping into a doorframe could lead to a massive bruise. That constant worry can take a toll on anyone. Kids with ITP often feel left out. They might not be able to play sports or join in on activities with their friends. And they might not understand why they have to be so careful. It's hard for kids to hear no when they just want to have fun like everyone else. For adults, the emotional challenges are different. Many people with ITP feel isolated because their condition isn't visible. If someone doesn't see the bruises or bleeding, they might think the person is fine, but inside, the person might be struggling with fear, fatigue, and frustration. That's why it's so important to talk about ITP, not just the medical side, but the emotional side too. Why should we talk about ITP? Raising awareness about ITP is so important. When more people know about this condition, they're more likely to recognize the symptoms early. Early diagnosis can make a big difference in managing the condition and preventing serious complications. Talking about ITP also helps reduce the stigma around invisible illnesses. Just because you can't see the symptoms doesn't mean they're not real. When people understand what someone with ITP is going through, they're more likely to be patient and supportive. And raising awareness helps drive research. The more attention a condition gets, the more likely it is to receive funding for studies. That funding can lead to better treatments, or maybe even a cure someday. What can you do to help? You don't have to be a doctor to make a difference. There are simple ways to help. Start by learning about ITP and sharing what you know with others. Talk to your friends and family. Share this video or other resources to spread awareness. If you know someone with ITP, ask how you can support them. Sometimes, just being there to listen or offering a kind word can make a huge difference. Small acts of kindness can go a long way. You can also support organizations that focus on rare diseases like ITP. These groups work hard to fund research, raise awareness, and provide resources for patients and families. And if you have ITP, remember that you're not alone. Talk to your doctor, ask questions, and stay informed about your condition. The more you know, the more confident you'll feel in managing it. Immune thrombocytopenia might not be something you think about every day, but it's a condition that deserves attention. It's not just about low platelets. It's about how this condition affects every part of someone's life. By learning about ITP, we can help spread awareness, offer support, and push for better treatments. If this video helped you understand ITP better, please subscribe to Earthluxe and hit the notification bell. We're here to bring you real stories about real issues that matter. Thanks for watching, and we'll see you in the next video.